Good day to all. Okay, so good day to all. Welcome to our instructional lecture on the unit of competency responding to emergencies. For today's discussion, we will be continuing the lesson 2, lesson 3, and lesson 5 of this unit of competency. Okay, so last meeting or last the previous topic that has been discussed under this unit of competency is all about the different measures in preventing the spread of infection. So for today, we will be tackling on the different measures in responding to emergencies, accidents, threat, and situations of danger. Okay. So, but before that, let's learn first the different signs, okay, the different signs and symptoms of potential illness. So, in patient care, whether it's in the hospital or in the home care setting or in home for the aged, we need to be familiar with the different key danger signs that our patient might be experiencing. So, first sign, we have the difficulty of breathing or breathlessness. So, if you note that your patient have breathing difficulties, nahihirapang huminga, masakit ang kanyang dibdib, tapos kino-complain niya na parang walang hangin na pumapasok sa kanyang baga, sa kanyang airway, these are the first action that we need to do. First is we need to assess if the person is choking. No? If the person is choking, we do the Heimlich maneuver or we do back tapping. Okay, so later on, I will be thoroughly discussing all the um, emergency measures that we will be rendering in these cases of emergencies. Second is if the patient is not choking, try to administer medications that has been prescribed to the patient for breathing problem and seek medical advice or call emergency hotline. Like for example, if the patient is diagnosed to have asthma, okay, bronchial asthma, or the patient is diagnosed with chronic obstructive pulmonary disease or COPD. So may mga situations wherein the patient will experience exacerbation of his or her symptoms, okay, exacerbation of his or her conditions. And one of the signs and symptoms of an asthma attack or exacerbation of COPD is their breathing difficulty. So kapag may mga cases na ganun, we look into the medical record, okay? Or we should be familiar with the history of our patient and know what are the emergency medications that needs to be administered. Like for example, meron ba siyang ginagamit na puffing medication, okay, yung pang puff, For COPD, meron bang does the patient has been prescribed with salbutamol, salbutamol nebulizations, or kapag merong oxygen source sa inyong home care setting, okay, so we also need to administer oxygen. Second is for unexplained chest pain. So if the person has been suffering from unexplained chest pain, you need to calm the person and position him or her to his most comfortable position. Administer medications prescribed for chest pain, like for example, second is your unexplained chest pain. If the person is suffering from experiencing unexplained chest pain, first we need to calm the person and position him to his or her most comfortable position. Second is we need to administer prescribed medication for chest pain and call emergency hotline. If so happen that the patient will suffer from Emergencies, like for example, difficulty of breathing, there's no pulse or there's no breathing, and the patient turns to be unconscious, our immediate action is to do CPR. Okay, sorry for that interruption. So if the patient will suffer from difficulty of breathing, no? Tapos nawalan na siya, chest pain, nawalan na siya ng pulse, nawalan na siya ng paghinga, and the patient turns to be unconscious, we do CPR kasi yung pasyente siguro nagkaroon na siya ng tinatawag natin na cardiac arrest. So other signs of or other key danger signs, we have facial dropping, limb weakness, difficulty of speaking. So these are the indicative signs of stroke or your cerebrovascular accident. Okay. So our initial action, we need to call emergency hotline because the patient should be referred immediately to the nearest hospital for further care and management. Take note, kapag stroke kasi yan, we need to prevent, no, the possible severity of the condition. That's why we need to bring immediately the patient to the hospital. Another is we need also to calm the patient and place the patient in a recovery position, no? Or pwede rin siyang paupuin kapag wala siyang limb or extremity weakness. Pero kapag meron siyang extremity weakness at hindi niya kayang tumayo or hindi niya kayang umupo, we need to assist the patient in a lying position. Okay? So, if impaired consciousness naman or nawalan ng malay, always check the ABC. What is ABC? ABC stands for airway, breathing, and circulation. If partly conscious and diagnosed with diabetes, no, meron siyang history of diabetes, we need to check the blood sugar of the patient because the patient might be experiencing hypoglycemia. Okay? So, when say hypoglycemia, ito yung biglang pagbaba, no? Biglang pagbaba ng blood sugar ng patient. So what's the normal blood sugar of an adult patient? So the normal blood sugar of an adult is around 80 to 120 milligrams per DL. Kapag mas mababa sa 80, 70, 60, 50, okay, ang tawag natin doon is your hypoglycemia. Pero kapag more than 120, that's your diabetes or that's your hyperglycemia. Okay? So if partly conscious and has been prescribed with oxygen, no? The patient has been prescribed with oxygen, okay? We need to administer oxygen immediately and we need to call emergency hotline for further care and management. Okay? Next is your vomiting of blood, okay? So if the patient experience vomiting of blood, we need to first call again your emergency hotline because we need to refer the patient immediately. No? Kasi dugo na yung nilalabas, baka mawalan na siya ng dugo. And we give the person a bowl or container for the person or where your patient could vomit. And we need to keep a sample for medical personnel because they might need specimen for further testing. Next is we give the person a damp cloth to wipe his face and give him fluids to drink. Okay? Or sorry, do not give him fluids to drink. So instead of giving water, we could offer ice cubes or ice chips to remove the unpleasant taste in the patient's mouth. Okay? So wag mong pakainin, wag mong painumin, magbigay ka lang ng ice chips or ice cubes. Okay. So let's move. So those are the key danger signs. So please not forget these key danger signs: breathing difficulties, chest pain, facial dropping, limb weakness rather, difficulty of speaking, impaired consciousness, and your vomiting of blood. Let's move now to your responding to emergencies and accidents. Okay. So recognizing and responding to signs of potential illness. So take note that as a caregiver, we need to be aware of the general medical kit that are useful in helping carry out your nursing tasks, and it will help you deal with any medical problems that require first aid treatment or first aid management. So this means that if we are working in an institution, no, sa mga home care institution, or as a private caregiver, we need to be aware of the content of the general medical kit, okay, or yung tinatawag natin na first aid kit, okay? So, the usual home medical kit would contain the following. First, we have your triangular bandage, your um, waterproof adhesive, hypoallergenic adhesive dressing. Okay. You also have your thick absorbent non-adhesive surgical pads in small, medium, and large sizes, two of each size. So this means na ito yung mga tinatawag natin na gasa in Iloco. You also need to have a non-adhesive dry wound dressing in all sizes. Parang gasa din yan. Adhesive transparent dressing. Okay. Tubular bandages or your elastic bandages. Triangular bandages for slings, crit, and other bandages to secure the dressing. 5 sterile gauze swabs for cleaning wounds. Okay. 5 sterile cleaning wipes, eye wash, and 2 sterile eye pads, microporous tape or your micropore tape or your plaster, and 6 safety pins for securing bandage. So this is an example of your home medical kit. Okay. So your home medical kit or first aid kit are almost the same. The purpose there is to provide no emergency. So this is the source of it is a kit that would contain different medical equipment, okay, or medical tools or devices that are necessary in rendering care during cases of emergencies. So as a future caregiver, kapag meron tayong pasyente, we should also be aware kung saan natin pwedeng ma-access or makita yung mga first aid kit natin. Okay? Or your home medical kit. So, the first aid kit is the usual na alam natin, it's very familiar. So, the first aid kit would contain 2 coal packs for sprains and bruises. And take note that your cool pack needs to be refrigerated, okay, para cool siya. Okay, kasi kapag hindi siya galing, of course, kapag hindi na ref, hindi yan cool pack. Okay, we have your blunt scissors, your tweezers, disposable gloves for wound care, thermometer, resuscitation mask, medications, such as your painkillers, your acetaminophen, ibuprofen, or your paracetamol, antiseptic cream, or your antiseptic gel, and your antihistamine tablets. Okay? And we need also to make sure that the medications are not expired, no? And you should also need to check with the doctor of the person you are caring whether there are some medications that are contraindicated with him or with her kasi baka meron naman pala siyang allergic reactions to certain medications. Okay, that's why history of the patient should also be noted. Okay, so what to do during an emergency? So ano yung mga dapat nating gawin? Number one is we need to stay calm and follow a clear plan. Okay, dapat kapag may emergency, hindi ka na gusto mag-first aid or gustong tumulong. Yung hello, mic test. Okay. So dapat hindi ikaw yung hindi dapat ay kalmado ka. Ikaw na gustong tumulong o gustong magbigay ng first aid should have clear plan to follow. Okay? So there should be a systematic yung step by step mo kung ano yung ating gagawin. Okay? So first, stay calm and follow a clear plan. Second, check first your own safety before approaching the patient. Okay? Kasi instead na ikaw yung magbibigay ng first aid, tapos hindi mo na-check na hindi pala safe ang lugar, ikaw na mismo yung nagiging victim. So additional victim. So that would be additional problem. Okay? So like for example, merong electrocution. Okay, dati nakita mga makurkuryente. Do you need to approach the patient immediately and save him or save her? Of course, no, because you need to assess first the situation. No? Tignan mo kung meron bang open wire doon, live wire, meron bang sunog doon. Kasi kapag may mga ganong cases, huwag ka munang pumunta. Okay, you need to secure the area first. Okay. Number three, approach the person when the scene is safe and introduce yourself. Okay, so you could introduce yourself, like for example, I am Berkian Pugrad, I am trained first aider, or I can help. Mga ganon. And number four, make emergency call. Not necessarily na ikaw na yung tatawag, no? So if you are directly attending to the patient, ask someone of the bystanders to make an emergency call, okay? Or you activate the EMS na tinatawag natin. And the last is your set priorities. Okay? In setting priorities, first, you need to consider the following. Number one, when the person has fallen, leave her where he is rather, unless his life is in danger. Like for example, merong pasyente tumalon rather, okay, tumalon from the fifth floor of the building. Okay? Tapos andun na siya, no? Andun na siya sa floor. So leave the patient, no? Unless um, the situation, yung location niya is medyo risky, okay? Pero kapag okay pa naman yung kanyang situation or sa location niya rather, kung saan siya nahulog, leave the patient, no? Huwag mo munang galawin kasi kapag ginalaw mo yun, yun pala bali-bali na ang buto, okay? Tapos binagkat mo or you leave the patient. The problem there is you might cause further injury or further damage to the patient. That's why we need to assess his or her condition or yung injuries niya. Okay? And be careful not to exacerbate the injury. Another, prioritize patient with life-threatening problems. Problems in airway, problems in breathing, problems in circulation. So if they're going to ask you kung sino yung priority natin, yung pasyente na masakit ang tiyan or yung pasyente na nahihirapang huminga. Okay? Of course, our priority there is the patient who suffers from breathing difficulties. Take note, our priority is always ABC, airway, breathing, circulation. Okay? Nahihirapang huminga. Okay? Merong humihinga nga pero hindi tama yung kanyang paghinga. Mga priority natin yun. Tapos walang pulso. Okay? Or weak pulse, those are our priorities. Take note, if you are prioritizing patient, you need also to assess their level of consciousness. Okay? Check mo sila, are they alert? Do they respond to voice command? No? Or do they respond to pain? And carry out a quick head-to-toe assessment to assess the extent of injury. Okay? Okay, so what do we need to do if the patient is suffering or the patient has experience collapse. Okay, so first we need to check for airway, breathing, and circulation. So when the patient is lying on his back, take note that the patient's tongue may fall back and thus it would block the airway. So ano yung gagawin natin? We need to do the head tilt chin lift maneuver. Okay, we also need to call for emergency hotline and gently shake the person's shoulder and speak clearly and ask his name or ask him to open his eyes. Okay, this means that we are assessing now the patient's level of consciousness. And we need to check if the patient is breathing. How do you need to check the patient if breathing? Do a head tilt chin lift maneuver. Okay? On this, ang tawag natin dito sa first photo na to, that's your head tilt and chin lift maneuver. Okay? You place your arm on the forehead of the patient and your fingers, okay, or on the chin of the patient, and then lift the chin of the patient para ma-extend ang neck ng patient. Let me just zoom this for you. Okay, you put your arm on the forehead, your fingers on the chin, and lift the chin of the patient so that the neck will extend. Okay, if the neck is extended, yung kanyang airway ay diretso lang. Okay, hindi babablock ng kanyang tongue. Okay, so put your ear, on this picture, the caregiver puts her ear close as possible to the patient's nose or mouth and observe the look, listen, and feel, or LLF, for breathing and rise and fall of the patient's chest. Okay? So mapapansin natin, nilapit niya yung kanyang tenga sa bunganga ng patient sa kanyang nostrils. Okay? Kasi take note that our chin, no, dito sa mukha natin, very sensitive yan, no? Kunting blow lang yan, nararamdaman na natin kapag merong humihinga yung pasyente. And take note that the eye of the caregiver is looking directly on the chest or on the abdomen of the patient. Okay? Para ma-determine natin kung meron bang lumalabas or pumapasok na hangin, and to determine if the patient or to determine if there is a rise and fall of the patient's chest. Okay? If breathing, position him to recovery position. And if negative breathing, call emergency hotline and do CPR. Okay? On the third picture below, ang tawag natin dito is your recovery position, or you need to position the patient in side lying position. Okay? The reason here is para mas okay yung kanyang breathing and there's no need to do the head tilt chin lift maneuver. Okay, so in your recovery position, you need to place an unconscious person who is breathing in this recovery position to allow any fluid to drain from his mouth and to keep his airway open. So that's the primary reason, no? To ensure na merong pumapasok na hangin sa kanyang bibig or sa kanyang ilong, okay? At kapag merong mga fluid sa kanyang bunganga ay madidrain lang at hindi papasok sa kanyang baga, okay? So you need to place him on his side with the lower leg straight and the upper knee bent, okay? Para hindi naman siya uh, like for example, you place the patient on side lying, hindi mo inayos yung kanyang kamay, yung kanyang paa, baka mapakled yung pasyente or agibdan tombot lying. Okay, so the extremities of the patients are used for support. Okay, next is your cardiopulmonary resuscitation. Okay, so if the patient collapse, no, and the patient is not breathing, take note that the oxygen will not reach to the vital organs of the patient, such as the brain and his heart. Okay, so eventually the patient's heartbeat will stop. Okay, ang tawag natin doon, that's your cardiac arrest. Okay, so if there's no pulse, there's no breathing, we need to do the CPR or your cardiopulmonary resuscitation. So what is CPR? CPR is a combination of chest compressions and rescue breathing. So the purpose of doing CPR is to maintain oxygen supply to the body, no? To kumbaga parang ikaw na yung nagpa-pump, no? Ikaw na talaga yung nagpa-pump ng sa puso ng pasyente, okay? Para yung blood ay mag-circulate pa rin papunta sa utak and to the major organs of the body. Okay? You start with chest compressions to restore blood circulation because when breathing stops, the oxygen level in the blood remain the same initially. Okay? So in this case of emergency, or if you are doing CPR, you need also your AED or your automatic external defibrillator. So this is a common cause. Okay, take note that your AED tries to treat the most common cause of cardiac arrest, which is your ventricular fibrillation. Ano ba ang ventricular fibrillation? No? In a simplified explanation, ito yung maling pagpitik ng puso. Okay, so this is your abnormal heart rhythm or heartbeat. Okay. In the hospital, kapag nakikita nyo yung mga, kumbaga nire-revive yung pasyente, tapos merong dinidikit sa chest ng pasyente, sinasabi ng physician or the nurse or kung sino man yung andun, clear, and then nagde-deliver sila ng shock. Okay? Same concept with your AED. So your AED delivers a controlled shock from a machine called automated or automatic external defibrillator. okay, as soon as possible to correct the problem of ventricular fibrillation. Okay, so if unconscious, no, and negative pulse, negative breathing, we need to do CPR. Okay, so in doing CPR, we need also to do first the basic steps, okay, what to do during emergency. First, you need to stay calm, have a clear plan, ensure the safety, approach the scene, introduce yourself, have someone call the EMS or activate emergency hotline, and set priorities. Okay? And then you need to assess the level of condition. If unconscious, do the LLF. Look for the rise and fall of the patient's chest, no? Gaya sa picture na to, and feel and listen rather for breathing and feel for the pulse. Okay? How do you feel for the pulse? Okay? Usually, ang pinapalpate natin dito is the patient's carotid artery. Okay? Saan ba located ang carotid artery? Dito sa neck. Okay? Dito sa neck portion, okay, of the patient. Okay? How do we assess, no, the carotid artery? Using your two fingers, okay? Using the finger pad of your two fingers, your index finger and your middle finger. Okay, so if the patient has no pulse and no breathing, we need to request for an AED and start CPR. Okay, in our locality, saan ba natin pwede makita ang AED? Kapag napapansin nyo sa McDonald's, no, on the kapag ikaw ay nag-order sa counter, I think sa left side, okay, sa wall doon, merong nakalagay doon na AED. Okay? So, if you're able to visit McDonald's, doon yung makikita ang actual na kita ng AED. So, just like in the screen, ganito rin ang AED. Another is, in the Vegan City Library, meron ding AED doon. Okay, bakit may AED sa McDo? Kasi yung McDonald's before the pandemic, of course, you know that they operate 24/7. That's why kapag merong emergency, okay, pwedeng malapit lang, no? Pwedeng makuha sa yung AED sa location na yun. So, what are the steps in doing CPR? Okay, first, we need to, okay, make sure that the person's lying on his back in a firm surface. Okay, the patient, or the victim should be lying on his back, firm surface, para kapag ikaw ay mag-deliver ng compression, hindi pumapaloob yung pasyente. Okay, you need also to kneel beside him on the level of the patient's chest, no? Okay, like this in this picture, tama to, the level of patient's chest, and place one hand on the center of his chest. Okay? So take note, ang position in delivering chest compression is also critical. Okay, it's also crucial rather, or in order for us to deliver effective compression, dapat tama yung position natin. I'll try to zoom this one. Okay, mapapansin natin, the arm is almost straight, no? Para kapag nag-deliver ka ng compression, diretso yung force natin from our back, okay, dito sa ating arm and doon sa chest ng pasyente. Okay? So, dapat tama rin yung position ng ating knee, yung pag-bend ng ating waist, okay? And pag-bend din ng ating gently bending of our back, okay? Para tama yung position ng ating kamay. Take note, our hands should be straight, no? And in doing CPR, dapat ay hindi nagbe-bend yung ating elbows. Dapat straight lang siya. In this last picture, tama yung positioning niya, tama yung pagninil niya, pero sobrang malayo siya sa pasyente. Dapat ay lumapit siya para yung pag-deliver ng chest compression is diretso at hindi naka-angulo into 45-degree angle. Okay, the angle should be at least almost 90-degree angle. Okay, para effective yung pagkaka-deliver ng ating chest compression. So, in terms of your hand placement, our landmark here is your xiphoid process. Ang tawag natin dito sa buto sa ating chest bone, okay, in our sternum, okay, sa bone dito na pahaba, patulis rather, that's your xiphoid process. Okay, so usually place our hand at least or the heel of our hand in doing chest compression at least 2 inches above the xiphoid process. Okay? Because kapag sobrang baba, andun ka na sa xiphoid nagsi-CPR or below the xiphoid, hindi effective yung chest compression. The problem here is kapag yung xiphoid yung ating landmark and you place the heel of your hand on the xiphoid process, baka ma-break yung xiphoid process, no? Magkaroon siya ng rib fracture at baka ma-puncture or matusok yung lungs. Okay, the problem there is nagkaroon na ng bleeding, pumapasok pa ang hangin sa lungs. Okay, so hindi effective ang pag-deliver natin ng CPR and the problem of the patient. Another problem would arise. Okay, so take note, you need to place your hand on the top. Okay, place other hand on the top of the first hand. Okay, like for example, 2 inches above the xiphoid process, nilagay mo yung heel of your hand and your remaining hand, ipapatong mo din sa hand mo. Okay? And then interlock. Okay, this is an interlock. And interlock your fingers but keep them raised on the chest. Okay, so this is interlock. The fingers is interlocked but the fingers are raised on the chest. And lean directly over the person's chest. Then straighten your arm and press down on the breastbone or on the sternum to a deep around 2 to 2.5 inches or 5 to 6 centimeter. Okay, you need to also to release the pressure, but don't move your hands and or but don't move away. No. Do not release your hand. Instead, allow the chest to recoil. Okay, kasi kapag pinap mo to, babalik din yan. But wag mo yung tatanggalin yung kamay mo. Okay, let the chest come back or let the chest to recoil. So repeat. Okay, repeat to give 30 compressions at a rate of 100 to 120 per minute. So paano yung counting natin dito? Diretso na lang. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1. Okay, so this means that you have delivered already a one set of compressions. Okay? Total of 30. Okay? Dapat mabilis. No? Dati-rati kasi yung bilang namin noon when it's our first time to learn CPR is 1,002, 1,003. Pero masyadong mabagal. That's why the most updated counting by the American Heart Association is 1, 2, 3, 4, 5. Parang ganun. Para mabilis. Okay, do not worry, separate instructional video has been shared para at least meron tayong other resources. Number 3, we need also to move toward the person's head and open his airway. Okay, and put the one hand on his forehead and pinch the patient's nostril. Okay, pinch his nostrils shut and put 2 fingers and the other hand on the tip of the chin to lift. Take a slow breath, seal your lips around the person's mouth and blow into it until his chest rises. Okay, ang tawag natin dito is your rescue breathing. So how do you deliver rescue breath? Okay, let me just zoom this picture. So mapapansin natin, the first aider pinch the patient's nose or the victim's nose and the first aider open, no? Ang ginawa niya dito, head tilt chin lift maneuver, the first aider pinched the victim's nose, open his mouth, no? And then nagbigay siya ng rescue breath. So how to deliver rescue breath, okay? So dapat yung lip ng patient should cover the entire mouth of the patient. Okay, para kapag nag-blow ka or nag-deliver ka to rescue breath, no? Nakasil yung lips mo at hindi lumalabas yung hangin para diretso yung hangin sa bunganga, diretso sa chest ng pasyente or diretso sa lungs ng patient. Okay? So, you need to open the airway, head tilt chin lift maneuver, and then you need to pinch the nose and give 2 rescue breathing or rescue breath. Okay? You should also para ma-determine mo kung positive, no? Kung tama yung pagbigay natin ng rescue breath, there should be rise and fall of the patient's chest. Okay? So, since there are some concerns in delivering mouth-to-mouth resuscitation, meron tayong tinatawag na barrier. Okay? So, usually, merong mga barrier na nilalagay sa lips ng pasyente or merong parang cup, no? Ah, rescue breather ang tawag dito. Parang a cup siya that covers the nose of the patient and around the mouth of the patient. Okay? And if you blow that, mag-blow ka na lang sa rescue breather cup, and you should also note for the rise and fall of the patient's chest. Okay? So remove your mouth, but keep the nostrils closed and maintain the chin lift. And you should also look along the person's chest to watch it fall. Okay? So kapag nag-deliver ka ng hangin, if you blow air to the patient, dapat tignan mo na merong rise ng patient's chest. And if you release your mouth, no, and keep the nostrils closed, dapat makita mo rin na parang nag-exhale ng konti yung pasyente or there is a fall of the patient's chest. Okay? So give second rescue breath, and if chest didn't rise, adjust the head and try it again. Okay? Do not do more than twice. Okay? Hindi pwede ang tatlong rescue breathing. Only 2 rescue breathing. Usually, ang ratio dyan is 30 compressions tapos dalawang rescue breathing. Okay? So after you deliver 30 compressions, okay, fast and hard, you give 2 rescue breathing. I'll just check my presentation. Sorry for the inconvenience kasi nag-stick ang aking PowerPoint. Okay, so I think my presentation is okay na. Let me just fix my screen. Okay. So take note in delivering in doing CPR, 30 chest compressions. After delivering 30 chest compression, we give 2 rescue breathing or rescue breath. Take note that during rescue breathing, you should do head tilt chin lift. Okay? Your mouth should be sealing the patient's mouth. And upon delivering one blow, there should be a rise of the patient's chest. And upon releasing your first blow, okay, you should keep the nose closed and there should be a falling, no, para nag-exhale din yung pasyente. Okay, and do not give more than 2 rescue breathing. Okay, number 5, repeat compressions, okay, followed by rescue breath at a rate of 30:2 until help arrives and the person shows signs of regaining consciousness. Like, for example, the patient suddenly coughs, the patient suddenly opens his eyes, starts to speak, and moves purposefully. Okay? And if you are too exhausted to continue. Okay? So usually, ang importante kasi dito, no, dapat mabilis yung ating management. Okay, dapat mabilis yung ating management. Take note, puso yan. No? Kapag nag-stop ang puso, hindi nagda-deliver ng blood, okay, that contains oxygen going to the lungs, pwedeng magkaroon ng brain death, pwedeng mag-affected ang mga major internal organs of the patient. Okay? So the signs of regaining consciousness or the signs of life after doing CPR, coughing, opening his eyes, speaking, and of course, meron na rin siyang pulso. Okay, meron na siyang pulse. Okay. And when to stop, no? When to stop doing CPR? First, if the first emergency first aider or the EMS arrives, no? You should stop doing CPR and kapag sobrang exhausted ka na at hindi mo na kaya. Okay? So that's about CPR. Okay. So next is your choking. So what is choking? Okay, choking, of course, when your food goes into the wrong way. No? So instead na pupunta siya sa esophagus, let me just zoom this one. Instead na pupunta siya sa esophagus natin, pwede niyang i-block, no? Napunta siya sa may trachea and it blocks the airway. Okay, ang tawag natin dito, choking, no? Instead na diretso siya dito, papunta sa esophagus, napunta siya ngayon dito sa airway. So, when a food blocks an airway, no, it causes muscle spasm. And if the blockage is mild, the person may be able to cough it clear, no? Inuub, sila akong madijay natikakal, no? Iniloko, that's your minor choking or mild choking lang naman yan, no? But if that is severe, no, hindi makakahinga yung pasyente, and you need to act quickly. Take note, your elderly patients are very vulnerable. Okay, your elderly as well as yung mga bata, no, are very vulnerable to choking. That's why we need to ask them to chew their food and that's why we need to ask them to chew their food slowly and soft foods yung kinakain nila. Okay? So, in choking, kapag ano yung mga signs and symptoms? Usually, on this picture, tinatawag natin dito, that's your universal sign of choking, no? Usually, the patient would hold his or her chest, no? Hold his or her neck, and then hindi siya nakakapagsalita or sobrang nahihirapan na siyang huminga and the patient is anxious. So, if the patient is choking, you need to do the following. First, um, encourage her, no? Encourage him or her to cough out her food, no? But if he or she cannot cough out the food, doon na tayo mag-i-intervene. Pero if the patient is able to spit out all the food and nawala yung pagkanyang choking, then do not intervene. Just comfort and assist the patient, no? If she cannot speak and she stops to cough or breathe, okay, talagang nahirapan na siyang huminga, hindi na siya nakapagsalita, at hindi na niya ika-cough out yung foreign object, you need to give back blows. How to deliver back blow. Okay? So medyo you tilt the patient down and deliver back blow directly to the patient's back. Okay? Kumbaga, hamon nga bugbugin, pero parang ganun kasi yung mechanism doon. Okay? You should have a cup hand, hold, and then deliver 5 back blows on the patient's back. Okay? So you need to support the patient's body with your one hand using the heel of your hand. Give the 5 sharp back blows between the patient's shoulder. Take note, um, landmark there is the between the patient's shoulder. So stop giving back blow if the obstruction is clear and tell her or tell the patient to spit out his or her food. But if delivering back blow is not effective, we need to do abdominal thrust or your Heimlich maneuver. So how to do your abdominal thrust? You position yourself on the back of the patient and then wrap her abdomen around. How do you wrap her abdomen around? Okay. Your other hand, you need to clench, no? Clench one of your hand against the person's abdomen and grasp your hand with your other hand and pull sharply inward and upward up to 5 times, no? To deliver out the food. Okay? Or to deliver out the blockage. So, paano yung gagawin natin? Pumunta ka sa likod ng pasyente, you wrap your hand around the patient's abdomen, but there should be proper way of wrapping. Do not just hug your patient, okay? You need to clench your hand. You say clench your hand, parang sa boxing hand na ganyan, no? And ilagay mo sa baba ng xiphoid process mismo. And then, your remaining hand, hold your clenched hand and deliver an inward and upward force, no? Para yung force sa loob ng abdominal cavity ay pwede niyang itulong yung force na yun that you deliver, the pressure that's present in the abdominal cavity and your force, no, external force that you are delivering, it pushes out the food that has been blocked on the patient's airway. Nakuha? So that's the mechanism behind your Heimlich maneuver. You take note, at least 5, no? 5 times. So if the person's mouth, then after delivering your 5 back blows, after delivering your Heimlich maneuver, check the person's mouth again, and if she can cough, she can speak or breathe, repeat the procedure 2 to 3 times. Okay? If the patient is still choking, we need to call, okay? Or while doing that one, you need also to call, ask for help and call the emergency hotline, or ask someone to call it for you because you are the one doing the uh, Heimlich maneuver or the rendering first aid treatment to the patient. Okay? So continue doing the procedure until the food is being removed or until um, emergency medical service arrives. So next is your chest pain. So chest pain, ang tawag natin sa chest pain usually is your angina, no? Your angina is a condition that is caused by narrowing of blood supply in the artery of the heart that's supplying the heart muscle. So bakit nagkakaroon tayo ng severe chest pain? So let's zoom the picture. Okay? So just imagine the red portion here is your coronary artery. Sa coronary artery natin, kapag nagkakaroon yan ng blockage, okay, like for example, mga taba, okay, mga plaque or blood clot, tapos it blocks the passageway, walang dumadaloy na dugo. Just imagine na ang coronary artery is parang hose yan, no? Ginagamit sa garden hose. And kapag inapakan mo yung garden hose, on the distal portion of the hose or sa bunganga ng hose, walang lumalabas na dugo. Okay? Parang ganun ang angina na tinatawag natin. The problem there is if there is a blockage, no, it affects the heart muscle, okay, At kapag walang oxygen supply, no, yung muscle cells na ngayon ay nagpo-produce ng lactic acid. And that lactic acid is the cause of the chest pain or the painful or the chest, okay? The chest tightness or the chest pain that the patient is experiencing. Okay? So what are the signs and symptoms of heart attack? Number one, persistent vice-like pain or you're squeezing pain. Sobrang sakit, no? Parang naninikip, sobrang sakit at paninikip ng kanyang dibdib. And it usually spreads to the patient's jaw, no? Okay, to the other arm or to both arms. Okay, so yan usually yung sakit ng heart, yung pain that the patient might suffer if he or she has heart attack. Other ay ito sa kanyang abdomen. Okay, kapag hindi sa chest, yung sobrang sakit sa kanyang abdomen that is not being relieved by other medication or other first aid treatment or management. Okay. Next is feeling of discomfort in the abdomen that is similar to indigestion. The person will be breathless and is gasping for air, no? Nahihirapang huminga. He or she turns to be pale and grayish with cold, clammy extremities, no? Si cold, clammy, kasla ko kung kunad ng nananungan, naglalami isisunan, yun pala, atake na yun sa puso. Okay? And the patient's lips may be blue. Why? Because nagkakaroon na ng impairment ng circulation. The person may feel dizzy and faint and may collapse. The patient's pulse can be rapid, okay, then weak, and then becomes irregular and possible loss of consciousness. Okay? That's why kapag angina or severe chest pain, dapat mabilisan din yung action natin. Okay, so what are our initial management? First, you need to comfort the person. No? Pwede mo siyang position into half-sitting position with his head and shoulder and back being supported and his knees bent. That will ease the pain and strain on his heart. Second is call emergency hotline. Third, kapag you were able to note that meron na siyang history ng angina at meron na rin siyang gamot, okay, may mga pwede tayong ibigay unless the medication is contraindicated to the patient, no? So unless you know that he is not allergic to aspirin, we could give a full dose of aspirin, 300 milligram tablet, to limit the extent of the muscle damage. So pag binigay mo yung aspirin, you need to ask the patient to chew it slowly and rather than taking it with water. Okay? So you could also deliver anti-angina medications such as a pump spray or tablets, okay, to help him take those medications. Or pwede rin magbigay ng isordil or your isosorbide dinitrate. Usually, ilalagay yon sa baba ng baba ng tongue rather ng pasyente or your sublingual. Number 4, monitor the person's level of response and breathing and pulse. Okay, take note, watch out for possible cardiac arrest. Kasi during this time, yung pasyente ay pwedeng mag-cardiac arrest. Kapag mag-cardiac arrest yung pasyente, negative pulse, negative breathing, unconscious, what do we need to do? Immediately do CPR. Next problem is bleeding. Okay, take note, bleeding is the loss of blood from a wound, and this could be dramatic and frightening to the person, especially to our patient, no? So bleeding must be controlled as quickly as possible to prevent further damage to the circulatory system. So some elderly who are taking blood thinners such as anticoagulants, example, you have your warfarin, nagkakaroon sila ng impaired coagulation, no? Kasi sobrang manipis or sobrang malapot. What's the kabarikad of malapot? Sobrang watery, kumbaga, no? Hindi malapot yung dugo. Kasi kapag nag-take ka ng anticoagulants, hindi malapot ang iyong dugo. Kapag ikaw nasugatan, Instead na mabilis lumapot yung dugo para mag-stop ang bleeding, ang nangyayari doon, hindi lumalapot or walang blood and walang coagulants, okay, that will seal the wound to stop it from bleeding. So there are bleeding sites with special, or there are bleeding at special sites that we need to uh, need to consider. First is kapag nose bleeding lang naman siya, ano yung pwede natin gawin? You help the patient sit down and tell him or her to lean her forehead and pinch the soft part of the patient's nose, no? Spit blood and that is coming from her mouth and release the pressure after 10 minutes. If bleeding continues, redo the following. So when say release the pressure for 10 minutes, hindi ibig sabihin na naka-pinch ka na lang, no? For 10 minutes kasi hindi nahihinga yung pasyente. Okay, you should also allow the patient to breathe. That's why we need also to release the nose that is being pinched. Next is your burst in your varicose vein. So your varicose vein, saan natin makikita mga varicosities? Usually sa mga legs, sa legs, or sa your lower leg or your third thigh. Okay? So burst in varicosities, okay, kapag biglang pumutok yung varicose vein, no? What you really need to do, you need to lay the person down and raise the leg immediately to slow the blood flow to the area and apply direct pressure. How about if the patient have um, wound in his scalp? Okay? Usually madugo kasi kapag tuymuging or tuybumbunan tayo. Okay? So you need to apply direct pressure over a pad and sit the person on the floor. Okay? Don't lie down kasi mas lalong dudugo. Take note that the principle in bleeding kasi, no, the wound site of the injury should be at least higher than the patient's heart, no? Para yung pressure ng puso na nagpapump hindi masyadong malakas yung pressure at mabilis or grabe yung pagdurugo. That's why we need to apply pressure and then elevate the affected site. Okay, how about if the patient have bleeding in his mouth? No? If the lips bleeding, cover the wound with pad and squeeze it, or place a gauze pad in a bleeding tooth or socket and tell the person to bite on it. Okay, parang sa kapag nagpapabunot tayo, usually uh, 'di ba? Naglalagay sila ng what do you call that? Your cotton balls on the patient, on the tooth of the on the tooth, and then the dentist would instruct you to keep a bite on that gauze pad or on that cotton ball, okay, to stop the bleeding. So what are management of bleeding? First, apply direct pressure over the injured area. No? Take note, yung pang-cover natin should be sterile or should be at least a clean pad. Okay? And then you need to raise the injured area above the person's heart. So this will slow the blood flow and help her sit down. Place a pad on the wound. Okay. You could also apply bandage to secure the pad. Okay, but in applying bandage, it should be not too loose and not too tight to ensure the circulation of blood supply in the affected extremity or the affected area. So you also need to help the person support the injured area in a raised position. Like for example, paa or kamay, you need also to support, no? Pwede mong ipatong yung paa sa isang chair or yung stool or ipatong yung kamay sa table or chair. Okay, at least higher than the patient's heart. So the problem in severe bleeding is your shock or your hypovolemic shock. Okay, so your hypovolemic shock is a medical condition that is life-threatening, no? Kasi large amount of blood supply are lost in the body. Okay, so this may be due to bleeding or may be due to burn. Okay, so what are the signs and symptoms of shock? Okay. So, by the way, bakit nga ba na very risky ang electrocution, no? Yung mga electrocution, nasusunog yung balat, di ba? Yung mga nasusunog na body part ng body. Ano bang nangyayari? 'Di ba nagkakaroon ng parang blister, no? In that blister, anong laman nun is dugo. Ay, sorry, not dugo, but fluid. Okay? And in those situations, instead that those fluids should be at least inside the cell or intracellular, pumunta siya ngayon sa interstitial space. And the problem there, instead na tama yung blood volume or yung fluid sa katawan ng pasyente, parang konti na ngayon yung fluid sa katawan ng pasyente kasi wala na siya sa loob ng cells. So what are the signs and symptoms of shock? First, your rapid pulse that is very rapid and then gradually weakens over time, cold, clammy extremities. Meron ding cyanotic appearance or gray blue skin or lips, weakness, dizziness. The person may vomit. The person becomes thirsty. As the oxygen blood drops, the person becomes aggressive. Meron na siyang changes in the behavior or becomes restless and may be unconscious. Okay? If the person turns out to be unconscious, the heart of the patient might stop. Okay, so what are our initial management? First, you need to treat the obvious cause of shock. No? Kapag mayroong open wound, need to apply direct pressure to control the bleeding. No? Kapag burn naman yun, you need to cover the area. No? You need to cover the area with sterile gauze or sterile pad or a transparent covering. So you need to reassure the patient and help her lay down and put anything. Okay, you need also to apply blanket to keep the patient warm. Don't put anything under her head and raise her leg as high. Okay, but you also need to support the patient. You also need to loosen the tight clothing and neck of the patients and waist. Okay, and call emergency hotline. Okay, so if the patient suffers naman from head injury or concussion, so when say concussion, this is a violent jarring or shaking of the patient's head that affects already the patient's brain. So like for example, merong pumalo sa ulo mo, no? Affected na yung brain mo, nag-inflame. Okay, merong inflammation and wounds in yung brain. Ang tawag natin doon is your concussion or your uh, concussion rather. Pero kapag nauntog ka, merong bukol, ang tawag natin doon is your contusion. Okay? Contusion is your bukol. Concussion is the injury in the brain. So, delikado ba to? Yes, of course, delikado yan kasi utak na yan. You take note that uh, our brain manages, no? Or manage the entire body, no? Kapag mayroong affected ang brain, affected na ngayon ang entire body. So what are the usual signs and symptoms of head injury? Number one, loss of consciousness and the patient becomes drowsy. They may forget the history of the event or kung anong nangyari. Suffered from headache, indention of the skull. So indention of the skull would indicate na merong skull fracture. Like for example, on this picture, this is an example of indention of the skull. Indention, pumaloob yung isang portion ng skull, merong skull fracture na yan. Okay? Possible concussion na yan. Ano pa? Watery, blood-stained fluid leaking on the patient's ears, nose, or mouth, which is indicative sign of skull fracture, vomiting, dizziness, and changes in breathing pattern. Usually, no, yung mga nagmomotor tapos walang helmet, they are very triste to traumatic brain injury. May mga pasyente kami noon na mga vehicular accident, kapag may mga lumalabas ng dugo sa kanilang ilong, tenga, no, fluid blood stain, indicative sign of traumatic brain injury, and that is very risky kasi kapag hindi yan naagapan, it could result to death. So what are your management for head injury? The person is fully conscious, help her sit down in a comfortable chair, okay? Or kapag nasa floor na siya, no? You do not need to lift the patient, but just position the patient, no? Lying on his back. But if she is not fully conscious, no, you need to call emergency hotline already. Next is you need to apply cold compress or apply a bag of frozen peas or ice wrapped in a towel against the injury for 10 minutes to minimize swelling. No? If the patient becomes drowsy and confused, you need to call immediately emergency hotline and monitor the patient's level of consciousness, patient's pulse, and patient's breathing. Kasi baka magkaroon din siya ng cardiac arrest. Okay. Next is your suspected stroke. So your suspected stroke or your brain attack or stroke. Okay. So in In this case, no, sa mga cases ng stroke, dapat ay mabilisan din yung ating action because time is very crucial sa mga cases na to. So you need to use the fast mnemonics or fast acronym to test to confirm whether or not the patient has suffered from stroke. Okay, so later on, so ano ba ang fast? Okay, so fast, letter F, it stands for face dropping. So pantay ba ang kanyang mukha or medyo tagilid na yung isang portion ng kanyang mukha. Another is arm weakness. Okay? You need to ask the person to raise his both arm, okay, and his leg as well. Okay? Or bend his leg. Pag napansin mo, the patient can raise the right arm but the left arm ay very weak. Okay? Might be a problem. Another is speech, no? Is meron bang slurring of speech? Unable to speak ba siya? Coherent ba siya? Confused ba siya? So, those are indicative signs of stroke. So, ano pa? Okay, we have your facial weakness that is very noticeable. On one side, weakness of the extremities, difficulty of speaking, difficulty of swallowing, no? Numbness or paralysis, wala siyang balance or coordination, the patient is confused, headache, blurring of vision. Okay? We have patient before in the community. Kami ay naka-duty sa isang community at pumunta yung couple na nag-harvest sa health center. And nandun kami. So, nung napansin na namin na meron na siyang weakness ng kanyang right portion of the body, tapos siya ay medyo confused, we took the BP, sobrang taas ang kanyang BP. So what do we need to do? We need to refer it immediately the patient to the nearest hospital kasi sign ng stroke yun. Okay? So what if there are cases of bone, joint, and muscle injuries? Take note, our elderly are very vulnerable to muscle. Okay, muscle injury, bone fracture. No? So that's why we need to take care with our elders and assist them in their activities of daily living. So usually the different signs and symptoms of bone, joint, and muscle injuries are the following. First, pain and difficulty of movement, swelling and bruising, deformity, sensation of the bone is moving. So if napansin natin nahulog yung pasyente sa floor, first we need to encourage the patient, okay, to support the injury by hand and not do it for her. Okay, like for example, ask him to raise his hand, no? But if he cannot raise his hand, wag mo nang pilitin. Okay, you need to make the patient comfortable if she can't get up. We need also to immobilize the area, no? To prevent further injury. So how do we immobilize the area? Pwede tayong gumamit ng strain, okay? Pwede tayong gumamit ng splint, okay? Para hindi mo further damage the injury. And then bring the patient immediately or call emergency hotline for further care and management. So next is your special sites of injury. So kapag merong injury sa wrist and hand, we need to wrap a towel around the injury and help the person support the injured arm by hand so that the hand is higher than her elbow. Okay, so kapag merong elbow injury naman, if the elbow can be bent, uh, do do the procedure uh, as above. Okay, so which means we need to wrap the injury, no, and support it. Okay, so but if she cannot bend her arm, lay it across her lap and support with caution. So parang magbibigay na lang tayo ng support dito, okay, because we need really to immobilize the affected area kasi kapag you keep on moving the affected area, pwedeng ma-exacerbate o pwedeng ma-damage further yung fracture kapag fracture yung nangyari. How about leg? If the leg of the person or leave the person in the position where it's being found and place the rolled towels or blanket along each side of the injured area to prevent movement. How about if kapag pelvic? Pelvic is very critical to adults, no, sa mga lolo't lola natin. We need to place rolled blanket along each side of both legs and ask her to bend her legs slightly if she can. Then slide the cushion under her knees. Okay, so we just, kumbaga we elevate, no, the adjacent area para hindi mag-swell. Okay, but if she cannot move, just put rolled blanket on the side, okay, to immobilize the patient and at least to provide sort of comfort. How about if knee? If the person lie down and support the knee is bent, or help the person rather lie down, support the knee in and bent position with few cautions. And we need also to wrap soft padding around it. Okay, next is your burn. So your burn, we have different classification, no? Meron tinatawag tayo na first degree, second degree, and your third degree burn. So kapag first degree burn, epidermis or your outer skin, second degree burn, epidermis and your middle skin, and third degree burn would also include epidermis, the muscles, and the subcutaneous tissues. Okay? So ang tawag natin dito, that's your first degree, second degree, third, and your third degree burn. Okay? Or your superficial, superpartial, deep, and your full thickness burn. So, what are our initial management kapag nagkaroon ng burn injury? First, we need to hold the area of the injured and immerse it, okay? O kaya immerse it in running water or hold the injured area under cold running water for about 10 minutes until the pain would stop. Okay, kapag walang running water, pwedeng milk rather, or canned drinks. So, if there are cooling in the area, remove any clothing or jewelry before swelling start. Kasi kapag mayroong burn dyan, like for example, sa arm, okay, meron siyang wristwatch, pwede mo nang tanggalin mo agad para hindi na mag-swell. Okay, kapag sa damit naman, you need to cut the cloth or cut the patient's clothing to prevent it from stocking. Next, you need also to raise and support the injury, and you need to cover the burned area with a length of a kitchen wrap. Okay? But take note, kapag extremity yan, lower extremity, kapag paa yan, huwag ka nang maglagay ng kitchen wrap kasi hindi na yan makakalakad or problem hindi na yan makakalakad or makakatayo ng maayos. Kung kapag upper extremity, pwede. Okay, but don't wrap any limb of the patient. Okay, you may also, kapag wala tayong kitchen wrap, you may also use a clean cloth or a sterile cloth or linen to cover the injured area and seek medical advice for any burn that's larger than 1 inches or 2.5 centimeter. Okay? Next is your bruising. Kasi bruising is antal. Okay? So, usually, no, kapag tayo sorry. Tama, bruising. Tama. When you say bruise is your pantal. So, kapag tayo nauntog, kapag tayo nasugatan, pwedeng magpantal yung mga area na yun. So, ano yung gagawin natin? You need to position the patient, sitting down position, or make her comfortable on the floor. Raise the injury above the level of the heart, and to reduce the blood flow in the area para hindi na mag-accumulate pa yung dugo doon at walang masyadong pantal. You need also to hold the injury to minimize the swelling with the use of your ice pack, okay? And apply it for at least 10 minutes, okay? But don't let the area become too cold, okay? And another, if pain or swelling is severe, you need to wrap soft padding around the injured area for extra support and seek further medical advice. Okay? Next is your seizure, okay? Or yung tinatawag nila usually epilepsy, no? But epilepsy is one of the type. But when I say seizure, ito yung stiffening, okay, and continuous jerking of the body, okay, that is caused by, it could be through brain infection, no, or other severe medical conditions. Okay, so commonly the cause of epilepsy seizures can occur if the patient is suffering from disease such as that affects the brain or after head injury. So ano ba yung phases ng seizure? Meron tayong tinatawag na tonic phase, meron tinatawag na clonic phase, and post-ictal phase. So your tonic phase, that's your straightening of the body, yung patangken. Okay, after yung patangken yung extremity na, santo agkuyag-yeg, ano? Doon na yung jerky. And after jerking, magsusubside din yan. Okay, but take note that is quite dramatic. That's why the relatives of the patient or maski yung mga bystanders would usually um, what do you call that? We usually panic, no? So first, stages of seizure. Ano yung mga stages of seizure? Una, magko-collapse yan. And then the body becomes rigid, tonic phase. The body have jerky movement, clonic phase, followed by breathing difficulty, drooling, and then the patient would turn relaxed and regains consciousness. That's your post-ictal phase. So what are our management? First, do not if the seizure start, you need to clear the area, no, or the space around the patient to prevent her from falling or restrain her. Okay? I don't try to prevent her from falling rather or restrain her. So which means na kapag andyan yung pasyente at ongoing na yung kanyang convulsions or seizure, huwag mong pigilan yung pasyente, no? Kapag nakaupo yung pasyente, tulungan mo na lang yung pasyente na ipahiga sa floor, but do not, huwag mong pigilan yung pasyente sa kanyang pagsisisyo. Okay, so just allow her or just observe the patient, okay, and ensure that the site is safe, okay, or the environment rather is safe. Next, you need to place soft padding around her or against a furniture. You could put a rolled towels or cushion around her head to protect the patient's head. When the convulsive movements stop, she may be very sleepy and you need to place her in a recovery position the um, to allow draining, no, for fluids, okay? Kasi during seizure, pwedeng nagkakaroon niya siya ng drooling, pwedeng maraming salivation or excessive salivation at para hindi ma-aspirate yung pasyente. Okay, that's why you need to place the patient on side lying or recovery position and call emergency hotline. Take note, during seizure, you need also to time the seizure kasi tatanong yan kung anong oras nag-start at anong oras nag-subside. Okay? So, I think that's the end of our recorded lecture for today. Okay? So, supplement instructional videos has been uploaded already in our Google Classroom. So, you feel free also to search for other demonstration videos. If you have any questions, just message me in our chat box or in our group chat. Again, thank you very much for your time.